In your health news, cases of whooping cough are on the rise across the country. The infection is especially dangerous for young children, but anyone can get it. And so far this year, CDC data shows the number of cases 5 times greater than last year, with new ones continuing to be reported. So joining us now to talk about it is our medical expert, Dr. David Winter with Baylor Scott & White Health. Dr. Winter, thank you as always for joining us. And let me just ask you first, explain to us what whooping cough is.
Yeah, whooping cough is a bacterial infection that affects the lungs and causes pneumonia in adults and children. Now, adults do pretty well with it. Typically, they have a very mild illness, but children don't. And the cause is thought to be the fact that children's lungs are smaller, their airways, their bronchial tubes are smaller. They can get congested a lot more quickly with that. And that's also why they have this characteristic cough. I'm going to try to imitate it because here's what a kid will do. Trying to get air in. That's the whooping cough.
It sounds like a whoop, and I want to make sure I get it right. It is whooping cough, not whooping cough. At least that's how you're saying it, so I'll defer to the expert. Now, why are we seeing so many more cases this year?
It's thought that during COVID, a lot of us hunkered down, wore masks, didn't get out as much socially, and with that, the bugs didn't have a chance to jump from person to person and stay alive. So we're seeing an increase in a lot of respiratory illnesses, including whooping cough, all due to the COVID precaution that we took years ago.
Okay, so how is whooping cough treated then?
Yeah, it's a bacteria, so antibiotics do work. Now, typical penicillin, amoxicillin, those don't, but there are other antibiotics that do work well with this. And of course, decongestants, cough medicines, those work well also. Young children though, particularly children under age 2, they typically need even more respiratory help. Some of them need oxygen, some of them need to be put on respiratory machines. In fact, it's said that of kids under age 2, if they get it, they have a 50% chance of requiring a hospital stay. So very serious for young children.
So treatment is one thing, prevention is quite another. We'd like to prevent it before treatment is needed. So what can be done to prevent infections from happening?
Yes, so the official name of whooping cough is pertussis. That's the bacteria. And there's a vaccine for that. It's actually with 2 other vaccines, DPT or Tdap, that's diphtheria, tetanus, and pertussis. Those work very, very well. In fact, it's said that adults should get that every 10 years just to keep your immune system going with that, especially if you have kids or grandkids that are quite young. You don't want to get it and spread it to your loved ones. Chris?
Absolutely not. Dr. David Winter, thank you very much for telling us all about whooping cough, including the correct pronunciation. Thank you.
Always good to be with you, Chris. Thank you.